Hey, welcome everyone. Good afternoon, good morning. Thank you for being here. My name's Christina Botticelli, and I'm the Senior Manager for Leadership Programs at NCHL. And I welcome you all to the Lens Bridging Academia to Industry Final Council Call of the Year. It was great to see many of you in Chicago for our in-person uh, council meeting at the Drake Hotel, which was great. It was wonderful to meet you in person and get to kind of uh, set the groundwork for the conversation we're going to have today and into 2026. I want to give the opportunity for new members to introduce themselves. If you're new to this council, I'm looking at you, Jessica, and others. If you want to introduce yourself. It's muted. I wonder if it. Oh, okay, we're good.
Wait, okay. I was like, was that me or hi, hi everyone. I'm good at Zoom. But nice to see all of you. I see some familiar faces that I got to meet in Chicago at the NCHL conference. And if I haven't gotten to meet you, I'm Jess Beakley. I lead our learning and development team at UPMC, which is a healthcare organization headquartered in Pittsburgh, Pennsylvania, with about 40 hospitals across the state of Pennsylvania and into New York and Maryland. And we also have an insurance services side. So we're a payer and provider. So was grateful to be asked to join the meeting and spend some time with you at the conference as well. So thanks, Christina.
Jessica. And since it's such a intimate group, I'd say if we can maybe just go around and do full introductions. I know Karen, we briefly met at the conference, but if you'd like to introduce yourself and then popcorn it over to another member, please.
Yeah, thanks, Christina. Hello, everybody. My name's Karen Hammer, and I'm the Iowa MHA Program Director and Clinical Professor. So grateful to be here and nice to meet all of you.
All right.
And I'll go next. Kevin Broom, MHA Program Director at the University of Pittsburgh. And I will hand it over to, how about Joyce Ann?
Hi, everyone. Joyce Ann Wainio. I am Program Director over the Rush University HSM program. And I'll pass it along to, well, let's see, Kelly.
Hello, I'm Kelly Scheider, Program Director for Ohio State's MHA program. And I'll turn it over to Bob.
Thank you. I am Bob Bonner. I'm Program Director at George Washington University in DC. And I'll pass it along to Malia. Are you there?
I'm here.
Okay.
Happy to be here. I am Malia Nellens, Program Coordinator at NCHL, steering the NCAF program. So y'all hear from me a lot. But I will pass it. Looks like we have Jeffrey on. I'll pass it over to Jeffrey.
Hello, I'm Jeffrey Sims from UNC Chapel Hill. And I'm sorry, I'm on my phone. I can't see others who are on, so someone take it and run with it.
Thank you. It looks like Janaea, our colleague at NCHL, if you want to introduce yourself.
Yeah, sorry guys, I don't have my camera on, but I'm Janaea. This is probably the first time many of you have met me. I'm the senior data analyst here with NCHL, and I oversee Lens as one of my programs. And I'm happy to work with you all.
Thank you. Everybody, right? I think we went around and got to meet. I wanted to just spend a couple of minutes. I met with some members between Chicago and now about what to share in this meeting and just to make the most of this meeting. We do have some leadership updates in service of NCHL business. At present, we are, many of you know, our former CEO, Mindy, had left the organization this summer. And so we're currently conducting a search for new executive leader to fill that position. Very an important role for the organization, and just wanted to share that update. At present, we've got Jarrett Fowler and Megan Nussain, who many of you know, who've been with the organization for quite a period of time, and they've got great historical knowledge and understanding of how the programs work. So we've been in good hands. In addition to our board, who Jeffrey serves on our board as well, members have been instrumental during this period of time of growth and change. And I've been in my past 7 months now privileged to get a chance to know many of our board members too, and in service of guiding NCHL to advance to the next level. So I'm encouraged and optimistic for the future, and just wanted to share transparency of the update for where we are in terms of our internal governance and structure. Some other NCHL business, we of course kicked it off with talking about our Leadership Excellence Summit in Chicago, which was wonderful. We had about 120 attendees who were there. Jessica spoke, had a breakout session, which was great. We had probably 27 or so speakers, and it was just a wonderful opportunity. We just got back from West Palm Beach in Florida, where USCIP, the other side of NCHL, had their annual meeting, and it was, again, wonderful, enthusiastic. It's the side of the house that supports international patient programs. We had about 220 attendees at this event, and again, it was like a 3-day event, and it was absolutely fantastic. Totally filled my cup. So I was able to see kind of both sides. I affectionately called it like the house, like both sides of the house, to see what everyone is doing, and again, encouraged by the opportunities for some collaboration between both programs in service of developing our leaders, improving patient outcomes, and all the quality initiatives that is going on both in the academic side and in the industry side, which is very much the purpose of this council. So there will likely be some more like conversation to come as to and guidance and ideas and support that we look to glean from this amazing group here. Just some updates on the competency model. For those of you who are in Chicago and were able to join, we had our first focus group. Oh, go ahead, Kelly.
Sorry, before we transition, I did have a quick question on the leadership update. I understand you're involved with a recruitment for a new leader to take that position. Do you have any kind of timeline? Like, I know Mindy left in the summer-ish time period, but like, do we have some kind of timeline? And if you've already talked about this in Chicago and I missed it, I apologize.
It's a good question. I can't speak to a timeline. I think what would be, and this is just to share in terms of what we're looking for, is the best individual who's going to lead us to the next level. So I'm hesitant to share a timeline that I'm not privy to, but I know that it's important to the board, our team, our members, that we make the right selection. I apologize if that's like a PC kind of statement, but it's
no.
It's true.
So this is
It's
Jeffrey.
totally
Can y'all hear me? Can y'all hear me okay?
Go ahead, Jeffrey.
Yes.
No,
Yeah,
I was just gonna say, from the board's perspective, we wanted to get through the big conference as well as the holiday season, and then we're launching the search with the search firm after the first of the year.
That's helpful. And I completely agree with you, Christina. You definitely want to get the right person for the role. So I appreciate that.
Yeah, thank you. Great question. Thank you. Thank you, Jeffrey.
And let me also add, while we're talking about that, if you know of individuals you think would be competitive applicants for that, please feel free to send me their names and information.
Thank you. Some interesting work that's going on too, that we kicked off, a research initiative that has been really like a gold standard products of NCHL is the competency model. And I know Joyce Ann and the team at Rush were intimately involved with it from the get-go. And we got to have some great dialogue in the competency model focus group that was facilitated by Korn Ferry in Chicago. So thank you to those of you on the call who are a part of that kickoff and alignment and goal setting conversation. What's exciting about this model reiteration, revalidation, refresh, reimagination, all of the things is we're incorporating new and different perspectives and voices into this model. We're going to be extending the model to our USKIP members to participate in it. The international patient population members are heavily interested in ensuring that their leaders are prepared and developed to lead international patient programs here and abroad. And so they are very interested in being a part of this research as well. So we're excited for what that's going to look like and what that model will look like on all the different levels and the scale in which it will capture healthcare leadership competencies. So more to come with that. Likely after the new year, we'll be pulling together additional focus groups, and there will be opportunities for participating in developing surveys, sharing surveys, certainly opportunities for writing white papers and all of those opportunities for engagement that look different depending on what interests you to engage in this work. Reach out to me directly if you have any follow-up questions or would like to and are not currently involved and would like to be at different levels. I want to share if you've been with, many of you have been with NCHL for a while, and so you may be familiar. If not, we have a wonderful partner, DJ Mitch with the Pyramid Resource Group, leads the Healthcare Leadership Institute and is offering Leader as Coach programming at a reduced cost for our LENS and NCHL members, and wanted to share that with you if it's of interest of any of your colleagues that you're looking to help grow and develop and complete. There's two different options. There's a certified coaching pathway, or there's a 7-week coaching program. Different costs, different needs, different roles. It really would depend on who you're looking to send through that program. But the information's there, and if you have any additional questions, feel free to reach out. We had a call yesterday with Jessica's council, with the Leadership and Professional Development Council, and DJ came and talked about what coaching looks like. And it was kind of a great, I don't know, kind of filled my cup. I don't know if you have anything to share, Jessica, about it. Was kind of relevant. I think people are interested in either enhancing and growing their coaching programs on the industry side and continuing to evolve. If you have anything to add.
Yeah, I completely agree. And I've heard great things about the program too that DJ offers, and appreciate that she also offers a kind of discounted rate for NCHL folks. So always good to hear from her and to hear about that opportunity.
Thank you. Thanks, Jessica. We did put out an ask for a chair, a co-chair for this council. I had an awesome conversation with Kevin in Chicago, and I appreciate again you sharing the kind of the genesis of the council in which we're part of, and some goals that we have to truly bridge academia and industry, and what the governance structure should look like. And appreciate you and Michael chairing the council for so long on the academia side, but then what are we doing to bridge industry? So I really appreciated your guidance and suggestion to open it up to an industry chair in service of the governance structure for this council, which we have. I got a willing leader to step up from industry. Jared Stone from Henry Ford was interested in serving as chair, and he did share that he was going to be here. Something must have come up, so we'll I'll ask, I guess, again, if anybody else is interested. Without him being here, we can't do a motion to approve and things like that. But I'll just kind of hand it over to you with that topic, or anything else, Kevin, for opening chair remarks.
I'll just kind of expand a little bit on that for everyone else in the room, is that, when this was an academic only group, there was one chair, it was an academic member, but the goal of going to an academic to industry lens group was that you would have an academic co-chair and then a practitioner co-chair, and that would be the leadership structure that brings together the academic side and the industry side to try and determine, well, what are goals and priorities for the group moving forward. And in the transition period, Michael and I had served as the co-chairs, but that was really me handing over the academic side to him as we transition into trying to find an academic or an industry partner to be able to work with that co-chair position for the lens. So that's kind of the past, the present, and the future of the way the leadership is kind of transitioning. So technically, right now there's one co-chair, that's Michael. The other co-chair, we're waiting for an industry partner to be approved and put in place for that one. And so that's what we're hopeful for here soon.
Yeah. Thank you. Thanks, Kevin. I want to share too, there are two surveys that I put in the chat. If you already completed it, these are the same links that were provided in via email, and they were also in the body of the calendar invite. You don't need to complete it again. If you didn't get it, I would appreciate you completing the survey. One is for industry only, and one is for academia only. So just please fill out the survey that applies to you. And while we did have respondents on both, but not to call out, I'll give you some time to complete it, and likely we'll extend this. We just thought that there would be a value to share the results live that can help us prioritize and set some goals for 2026. The genesis of this idea, again, thank you, Kevin, for sharing your thoughts in Chicago on how we can bridge academia to industry. And the conversation we had was to highlight what is important for each. What do you want to do? What are things that are of interest to you? How do you want to do it? How would you like to commit, realistically? And kind of like, what does success look like, and what would be a value for you to engage in this work? There are two separate surveys that went out to each. I did share with Forrest. We got some time a couple weeks ago, and so that he could take a peek at it, see if we're on the right track. And with this information, we can start to see what the crossover is, and then lean into those areas where there's cross kind of pollination opportunities of sorts. I am just going to peek around and look. Is everybody completed so far? Just nod, shake your head. You're good. I'm going to ask Janaea. She's our data analyst. So I'm going to ask if and our Qualtrics person. I know, Kelly, you and I had shared our affection for Qualtrics. And so I'm going to ask that Janaea share, and we can look, if it's helpful, Kevin, if this is the right kind of way to go, pull up the survey live. We can look at it and see where we are for academia, and then we can see where we are for industry, and then it'll kind of prime maybe the conversations for next year. Does that sound okay?
It does. I just don't know what the results are going to look like inside of Qualtrics, because whenever I pull them up, Usually, if there's like multiple questions, a lot of the questions are kind of hidden and you can't see. And if you try and pull down everything, it needs to be cleaned up and presented in a separate way. And so looking at the raw data can be kind of clunky. So I'm just kind of interested to see what it looks like on your side.
Well, that's a good um, intro and setting some expectations. Just to share, the differences in the questions. We didn't just want to duplicate the survey, but the differences in the questions that we were asking is because there's different groups that we're serving. Ultimately, it's our patients, but there's different groups that we're serving. So with academia being focused on like preparing the students and shaping the curriculum, and then having industry focused on like solving operational challenges, staffing and onboarding, and like different operational and like workflow issues, and what are like the leadership needs that show up inside the healthcare system. So the questions are kind of tiered and tweaked so that we can draw the thread across both. And then also looking at some, again, like outcomes, joint publications, best practices. Industry has the opportunity to highlight some real world kind of challenges. And then academia could have the opportunity to translate some structured teaching tools and kind of augmented support. So just some things to consider. So Janaea, are we ready? Are you able to share the screen? Thank you for teeing it up, Kevin, that it might be clunky.
Yes, I'm ready to share. So I'll share my screen and we can go over the academia one. We have 9 responses. Compared to the industry one, it only has 1 response, but it doesn't seem like a real response because it's blank. So this is the start of the question where it asks us, everyone can see my screen, right?
Yes.
Okay. So, Christina, you want me to drive through the questions or do you just want me to share my screen? I'll drive through. Okay, so for the first question, this is where you fill out your organization so you can see which organization everyone comes from. If we scroll down a little bit, that's when we start to see some of the data. You can see that it's all about 11%. We all have about the same response except for the University of Alabama. We have 2. And then let's keep going down to our first question. Does it normally look like this for you, Kevin? Or just a little more flunkier?
No, this is good. This is summarizing
good?
kind of the responses in, but whenever
Yeah.
you pull the data and look at the actual responses, that actually looks really
Oh, yeah,
clean.
like in a different view, right? So this is the first question. Let's see. I wanted to be able to pull the whole entire question up so we can read it. Okay. I don't know why it's doing that. But as we can see, for the first question, it says, which topics would you be most interested in for exploring? And it seems like the votes are pretty similar. The highest ones we have is embedding real world case studies and experimental learning, following with AI, digital health, and data analytics and leadership education, and then aligning academic curriculum with evolving industry needs. Those are all hitting at about 6, with the rest 5 responses, 4, 3 for leadership competencies for early career healthcare. And then we go down to DEIB and belonging graduate leadership programs. Let's see what some people might have put down for other. If we had to. So leadership development programs, that was 1. All right topics. However, I would be happy with doing 1 topic. Well, the question says select all that apply. Okay. It should have let her select multiple.
That was me. I think I did it before we corrected the way
Oh, okay.
select multiple. So that's why I had to pick other for something.
Okay, okay.
But I think the ones that it's 6 or 5, like Those are really
Yeah.
good. My real point was let's just do one thing and not get too many things that we get going and don't accomplish it.
Yeah, quality over quantity. I agree.
All right. So let's go down to our question number 2. What types of collaborative outputs would you be most excited to create? And with our top answer, we have teaching case or learning module. Right behind it, let's see, we have toolkit for students in early careers. The same with 4 choices, best practices guide and joint white paper or brief. Next with 3, webinar series or a panel, conference session, proposal. And then we only have 1 vote for the podcast episodes. And let's see what the other may be. If we keep going down here, we can just see a little bit of it, how the numbers played out. But in other, we have problem solving, consulting opportunities, workforce education, training opportunities, and assessments. Okay. Then what formats would you prefer for collaboration? It seems everyone likes virtual, but they're kind of behind. Hybrid collaboration has 4 right behind it, so it's just a little above 50%. We keep going. Let's see. What time commitment feels realistic for you in 2026? So like 1 or 2 hours per month. That seems to be the average for about 60% of our members. I think we have about 8 questions. Let's see. Okay, are there specific industry partners or types of organizations you'd like to collaborate with? This is a fill-in answer. Less interested in supplier organizations such as med device or pharma, but overall open to a range of provider organizations, hospitals and health systems. Consulting continue to broaden beyond hospital health system, bringing in long-term care and primary care. Let's see, what curriculum or accreditation constraints should industry partners be aware of when proposing collaboration? So, the new CAHME criteria for accreditation, our program's curricula are mission-driven and somewhat constrained by the accelerator. Our time with the students is limited. Most of our 2-year programs, so we have constraints on how far we can develop them while in grad school. Insight on realistic goals and establishing priorities is very helpful. Let's go down. More accredited. Need to develop learning outcomes for the course activity and justify its inclusion in curriculum, but we have a range of mechanisms for generating and supporting activities outside of courses. I believe that was our last answer. Okay. What types of experimental learning opportunities would you like to expand? Let's see. Applied projects and capstones with 7 votes. Then we have simulation or case-based learning coming in at 5. And then with 3, we have site visits and leadership shadowing. Let's go down and see if anybody selected anything for other. All might be beneficial depending on the topic. All right. What additional opportunities would you see added value to the group? And I don't believe, okay, we have 1. I appreciate coordinating in-person sessions at other conferences and meetings to facilitate focused discussions. For example, meet while we also attending the ACHE meeting. So this is the one for academia. The one that we had for industry was 1 vote in here, but like I said earlier, it's actually blank, so that's not really beneficial to us. So I don't know, Christina, if you want to give everyone time to fill it out again and maybe share that data at a later session.
Yeah, that makes sense.
Yeah, I did fill it out while we were sitting here, but
Okay.
I honestly don't know that I gave it if I had time to give it some more thought, I could give you probably some more thoughtful responses and just didn't
Okay.
see it before today. Sorry about that.
No, that's fine. Let me see if I pull it back up if it will. We can review your response if you like. Let me just get it back up to see if it's loaded in here now.
We can also, I know that there's a lag just for, I know sometimes there's a lag with when Qualtrics like refreshes. It could be like 5, even 10 minutes, I've heard,
Yes.
before it gets in. So, you know, how about in terms of maybe coming to an agreement? We'd like to get more input, obviously, right? And so we can certainly share this survey more broadly. But would it be helpful if we can go over it and discuss, and then obviously, Jessica, welcome your feedback as we're looking at it. Um, I can grab the screen, okay,
Yeah.
Janaea?
Yeah, go ahead, Christina. It's all yours.
So Kevin, I am not as savvy as running the reports, but what I can do is screenshot. So I took lots of screenshots to be able to talk now about
And
it. I have in
sorry,
presentation.
Christina, Kevin has a question as well.
Sorry, go ahead.
Well, not really a question, just more of a comment. I think what would be helpful to kind of facilitate the conversation for the next one of these that we do would be to set kind of a deadline out there for people to be able to complete this and send them the links and send them reminders to do it until hopefully they do it. And then if this information could be compiled and kind of summarized and sent to us a week or so in advance of the next Lens meeting so that we could look at it and we can kind of digest it and come into the meeting ready to talk about it, that would be helpful for the group.
Yeah.
And maybe even already having some areas identified to where that you see that what academia wants to do aligns with what industry wants to do as being potential areas of collaboration to be able to talk about. Because whenever I send out these Qualtrics, typically what I do is I go in and I say, okay, send it, and here's the deadline for how long it's going to stay open. And then I set up like a couple of reminders. So if someone doesn't complete it, I'd send them a follow-up saying, would you please do it? And then if they don't, then I send them another polite reminder. And then typically that will garner some more additional responses to where that you'll have a good enough representation of the larger group.
Yeah, that's helpful feedback. I shared two. I put it in the calendar invite, and then I did put a reminder earlier this week. But I recognize everybody's very busy and can have email fatigue. But I appreciate your guidance with leveraging Qualtrics with the nudges that it has baked into it to get more feedback. We're looking to obviously increase the amount of industry folks that we've got on the call. I know Northwell, thank you, Jessica, for joining from UPMC. I know Northwell has expressed interest in joining. I've tapped Ohio Health as well to join. And then, of course, Henry Ford is going to be joining. Forrest had made a mention as with him not being on the call, but I want to give him credit for his ideas to like as a committee, as a council rather, looking at our membership kind of goals and targets for recruitment to ensure that it's balanced as well. And so that's something that I certainly take to heart and am continuing to recruit for this council. Anything just with respect for everyone's time that's here. I mean, I think that the information was kind of valuable to go through the exercise. Thank you, Janae, again for reviewing it. Were there any surprises with the topics of interest? You can see the screen, right?
Yes, we can.
Yeah, from the academic side, I didn't see anything that jumped out at me as being a surprise. The potential types of things that were of interest to us, different types of collaborations, are things that we've been discussing for, a year or two now. So, and I can already see that starting to come out in the responses that you're getting from the academic side.
A great coffee chat yesterday. It was Aon had put it on. There's a lot of really, I think, valuable information that I'm going to forward to our All Lens members if they didn't get a chance to see it. But it had to do with hospital benefits and workforce trends, and what employees are looking for and how employers are balancing it. I think there's some kind of nuggets in there that we can pull forward as well. Go ahead, Joyce Ann. I'm sorry, I don't know.
That's okay. I was just going to comment as well. I mean, I think there are some topics that maybe I didn't even think about, and as I'm noodling it here now, there's a couple things, especially with some of the programs that are currently on the call. We do, most of us, if not all, I think Ohio State will be starting theirs. We all have executive programs as well. And so we actually have a lot of input from executives that actually come back into to learn in our programs, that there may be some things to learn from some of them in terms of what their needs are that they're not getting, maybe in terms of the health system side. They're coming back into higher ed in order to get that. But there's a lot of, I think, great insights, at least what I've heard from our students. I don't know how that fits in, but it is kind of a nice bridge between the two, since they're coming in from healthcare at large. And the other is, especially in terms of the programs that are part of the association university programs, we actually have a faculty forum that looks at practitioners who are interested in teaching. And so there's also another crossover there potentially of folks who are in health systems who might be interested in doing more on the education side as part of their own personal or professional development and coming in to the classroom. So I'm not sure it fits in completely, but it is two other topics that came to mind while I was, working through the results that also really do bridge those two areas.
Something to share about the coaching. So the executive coaching and looking for opportunities to grow. There was a discussion yesterday in Jessica's council and the Leadership and Professional Development Council about benchmarking coaching programs on the industry side, like the size, how many FTEs, how many team members do you support, kind of the ongoing training, really trying to understand the operations of how to stand up and sustain and grow an effective coaching program at all levels. So there could be an opportunity for, we were going to explore what benchmarking would look like, and that could be an opportunity between both academia and industry, where we're looking to understand how the programs are operated and what are the gaps perhaps between both. I don't know if you want to, if anything to respond to that, Joyce Ann, or any thoughts?
Well, I just know, I mean, not specifically. I know that there are actually faculty members who are interested in coaching, like improving their own coaching abilities. And I know there's been faculty who have gone through the NCHL program. I mean, I believe Julie Robbins has done that, partly because of some stuff that she's doing or interested in doing. So the coaching piece does kind of cross both academia and obviously industry. Industry usually has more of them within their organizations. But, especially in terms of academia, coaching could be a really important part of an executive program. So people being trained to be able to coach and help people work through kind of their next stages could be very helpful. So I see that the coaching, just that work in and of itself also does cross, even though it might not seem perfectly relevant to academia. It is because there are people who coach within their graduate programs, and then they may have coaching on the side, who might be interested in participating with individuals who are actually on the industry side. So coaching does cross over both.
To the second point that you brought up about leveraging the clinicians who are interested in growing in the education space, and either learning a new skill or being able to contribute in a different manner. I think there's again like something there to pull forward. I think on the nursing side there's some numbers that came out which like 4 in 5 nurses have like 2 jobs or have like other revenue streams because of the cost of living, the compensation, their desire to grow and learn and kind of, so I'm curious if there's um, looking at some workforce trends and like specific service lines who may
It
be of
wasn't
interest.
necessarily just clinicians. I mean, we use the term, I guess, practitioner to mean anybody who's kind of in the field and it might come back in to teach. So somebody who's finance might come back in to teach in a graduate program. But then there's also, of course, physicians and nurses who do the same. They either come into our graduate programs in order to gain something they didn't get on the, during their own professional development, to gain management skills, and to develop some of the things that they had not learned, but now they find themselves in management roles. And then there's the kind of the opposite of that. There's people who are in the field currently, working in health systems who might be interested in then jumping into education in order to teach a course or to mentor students and so on. So there's just a lot there, I think, that does cross over.
I think there might be a tech issue happening with Christina's camera right now. Thank you, Joyce Ann. I really appreciated that. And I think the addition of the exec leadership, like that is a consideration that we definitely need to take in. So we'll definitely be taking that to all of the planning that's going into next year. Are there any other thoughts on the survey or any other comments that might be possibly useful for us to bring into planning for next year, or else we can go into other goals for the next year?
Can you hear me?
Yes, there you are. Hi. I think the You there, Christina? I see her, but I don't hear her. We have been having a week with technology, by the way, y'all. I feel like that is something that should be said. It's like right at the end of the year, we're having a few crashes. I think as we usually do with the December meetings, and I think Christina will possibly be okay with this, as we've had some quiet for a minute. As we usually do with our December meetings across Lens, I would love to hold the last 10 minutes for any successes of the year that anyone would like to share, of great projects that they've done, or really interesting things that their teams have taken on in the past year that they'd like to share out with the group, and maybe give themselves or their team members a pat on the back. And that could be any interesting places that you spoke this year, or networking events that you went to this year that you thought were particularly special. Any projects that students have worked on this year, that maybe I could steal for NCAP ideas out of selfish interest. anything that anyone would like to share?
Thanks, Leah. Thanks for my computer just totally froze. I know Kevin's got an accomplishment we should highlight. You just published another book.
Oh, that's true. Yeah, I was co-editor with Sumitra Bhuyan from Rutgers University. We worked with a bunch of academics and practitioners to edit a textbook. It's a basic entry-level textbook for people beginning into MHA or undergraduate healthcare management type programs, kind of a once-over, here are the business functions, here's kind of some of the big issues going on within the industry, sets a foundation for them to be able to transition into the rest of their curriculum. With a good foundational knowledge, and every chapter is co-written by an academic and a practitioner to kind of bridge the theory with the reality of what's going on out in the industry. So that's out there on the street now. So thanks.
Sounds like a good opportunity in the future for our industry members to be able to contribute to the body of knowledge.
Yeah, we'll definitely need to be updating for edition 2 and edition 3, and then the field will change. So we'll have to go back and adjust some of the chapters. And so it'll always be in process.
What's the name? What's the book title, Kevin?
It's called Fundamentals of Healthcare Management, and it's with Springer Publishing.
Marvel.
Congratulations. That's so awesome to hear.
Thank you. Now, just to kind of be clear, I didn't co-write the book. I was the co-editor, and so all of the work, the intellectual work, was all of our academic partners and all of the practitioner partners that co-wrote everything. We were the ones that were kind of herding the cats and keeping them all together and keeping them on track and giving them the big philosophical umbrella of what we wanted the book to be about, and so how their chapters needed to fit into it. So that was kind of the big role that we played, was giving them the big broad vision of the book and then keeping them on track. And then they were the ones that took the content and ran with it, wrote it up, and a lot of good content in there. So it was a team effort of about, I think it was about a total of about 100 people when you count me and Sumitra as the co-editors, and then all of the practitioner and the academic members that wrote the chapters. And there were some case studies that were built in there as well. So.
That's wonderful. Very good. Any other kind of exciting updates to share?
Yeah, I'll just share, Christina. Congratulations, Kevin. That's awesome. I look forward to reading that and using it. We had at Iowa, our 46th Samuel Levy Symposium. So our healthcare symposium that we brought industry leaders from all over, including Scott Becker. And so he was our keynote speaker back in September. And one of the things that he focused on in his discussion was just the workforce challenges, right? We mentioned that in our survey here, pipeline and workforce trends, not only for physicians, but nurses and allied health professionals. And he recently highlighted that in a podcast on the top 20 healthcare issues facing the United States. And so really just interesting to hear his thoughts and potential solutions. So I would say that was a highlight for the Iowa MHA program. We also had our key leaders, presidents of the college and of the healthcare system, CEO at that symposium with him there. So it was a celebratory event. So yeah, wanted to share that.
Any other opportunities? Kevin and Joyce Ann, I know I've been picking on you a bunch. Before my computer decided to go kaputs, I thought I heard the word mentor. I know I heard coaching, but I was curious if there was any discussion about mentorship or anything like this, and if there is opportunity for fellows or students and early careerists and mentorship possibility through NCHL.
I think that's certainly a way that the industry and academia side could partner together, is that finding people who are in the practice world that want to actively be involved in mentoring the future leaders of tomorrow that are still in our programs. I think that would be a great way. But I think the earlier conversation was more along the lines of coaching people throughout their career rather than just while they're in school. And so it's more mentoring while they're a student. But I guess mentoring goes on, and coaching and mentoring kind of overlap as constructs. But I think being able to find people who are in academia that are in industry that want to be involved in mentoring students as they progress through their programs before they get out in the field, there's certainly lots of opportunities to be able to do that. Everyone's trying to do that through their alumni network as well, but everyone's probably open to exploring people who are not alumni that are in the industry that have lots of wonderful experience also.
Mhm. Yeah, I mean, our alumni association does do it as well in terms of matching with the students. So it's a little bit of a closed group. But what I don't see is our alums, especially those that might be, mid-career, they're looking for mentors too, and they're making some really big decisions in terms of what's next for their career. And so they're looking to, maybe more senior leaders. They might be able to find them within our alumni group, but finding an opportunity for them to actually connect with others in the field in a mentoring relationship. I could see that would be something they would be very interested in. So more kind of our mid-career alums looking for something, with looking for leaders who might be interested. I know, creating a mentor-mentee program can be quite a lift in terms of matching and all the other things. I know there's been platforms out there that have done it, but they can be expensive. So, I guess if there's any way of making something like that happen in a fairly streamlined manner, leaders who are interested in mentoring and advancing leaders who are interested in being mentored would be, I think, very helpful. But
yeah, that's where our alumni association really has kind of focused their effort, because, having alumni that mentor our students, we've been doing that for years and years. But what our alumni wanted was more alumni to alumni mentoring, which is kind of the same thing, to where that if we can go and talk to our alumni and say which ones are interested in either receiving or mentoring people out in the field, and then all of the academic or the industry partners are doing the same thing, then I think collectively from both the academic and the industry side, you're going to have a nice pool of people that are interested and willing to serve as mentors for people who are out in the practice world.
Mhm.
And there's definitely a need and an interest in that.
Yeah. That's great. Thank you. Thank you both. Well, that brings us to the end of our time. Thank you for your energy in going through preliminary results, and then the guidance for next steps with being able to truly gather some more information. But I do appreciate the conversation and this mentor conversation. I'd love to kind of pull and keep that going. That's near and dear to my heart as well. Any final thoughts before we close? Okay. Well, thank you all for being here. Really appreciate to see you again. I hope you have a wonderful holiday and a happy new year. And I'll follow up with some notes. If you need anything, don't hesitate to reach out. Thank you all.
Thank you.
Happy holidays, everyone.
Happy holidays. Bye, y'all.
Bye-bye.
Thanks. Bye.